Welcome back, everyone. This is session 2. We're working on establishing SMART goals in order to prevent procrastination, hopefully some depression, and moving forward in your lives. In the first module, we talked about what chronic pain is. I'm just going to move forward a little bit with that. Chronic pain is essentially quite insidious. And what we mean by insidious is that it's everywhere. It creeps up on you when you least expect it. You could be fine. You could be at a dinner. You could be enjoying yourself. And all of a sudden, you're consumed with pain. So it's difficult to ascertain when it's going to happen. Unfortunately, for people who live with chronic pain on a regular basis, they know what I'm talking about. It's difficult to plan events. It's difficult to move forward. Because at the back of your mind, you're always thinking about, well, what if I have pain that day? So every facet of your life is affected by chronic pain. Chronic pain, it's relentless. It's incessant. It's perpetual. It controls your emotions, your thoughts, your behaviors, and your actions without you wanting it to be that way. So you may also be cognizant of it, but unable to do anything about it. When you become consumed by chronic pain, over time, it takes power over you. When you're consumed by it, you can't think of anything else. Everything you do is permeated by pain. Everything that you do is permeated by pain, meaning it defines you, it becomes you, without you wanting it to be that way. Again, it's psychologically it affects you, physically it affects you, and it's a whole vicious cycle that is difficult to stop. When we focus on the pain solely to the exclusion of everything else that we do, we ultimately relinquish the power that we have over our lives. We allow the pain to become us. It's almost as if we have somehow surrendered an aspect of our own identity within that pain. So how do we get that power back? Are we aware that we have lost it? The first step is to acknowledge that you have allowed pain to consume you. That's the first step. The second step is to decide that you actually want to do something about it. Now, right now, life is pretty, in the interest of remaining professional, it's disastrous. I really want to say something else, but you guys all get the gist of what I'm trying to suggest. So, since we have zero power, zero control, zero understanding of what the hell is going on, we can't move forward. So all we can do is cope every single day with what's happening. That's a loss of power. It's a loss of control, which can be very debilitating psychologically. So how do we get that back in order to move forward within the confines of the reality in which we now live? How do we establish goals that can allow us to move forward notwithstanding the existence of the pain that we experience on a regular basis? Well, moving forward requires or necessitates that you establish goals in order to avoid becoming stagnant, uninterested, apathetic, depressed, essentially resigned. I'm sure everyone else can attest to the fact that a lot of us feel resigned right now. We just feel like we want to give up. The moment that you give up is the moment that pain has taken over your life. It can be unconscious or it can be conscious. It's irrelevant whether it is conscious or unconscious. What is relevant is the fact that you're not going to allow it to consume you. There is so little that we can control in our lives right now. But specific goals that we have in the confines of our own reality can allow us to move forward. So, we're going to talk about SMART goals. I don't just mean I'm going to go clean out my, library today, but specific goals that have relevancy to your life. Goals that mean something, notwithstanding the pain that you're in. Again, I think I should take this moment to reiterate something. Cognitive behavioral therapy for chronic pain does not suggest, or it's not predicated on the assumption that we are here to eradicate this pain or to obliterate the pain. What we are suggesting, or what cognitive behavioral therapy adheres to, is the concept of coping with the pain, allowing your perception of the pain to be altered in order to live with the pain. Again, not to eradicate it. So I'm not suggesting that your pain is unreal. I'm not invalidating your experience of that pain. But notwithstanding the existence of it, you need to move forward. Rather, make the conscious decision of moving forward. So, SMART goals. There are key elements with respect to establishing goals. One of the drawbacks of establishing goals is that often people create goals that are vast. They're unrealistic, they're unattainable, and what ends up happening is they become disappointed because they are unable to accomplish that goal. The first element with respect to SMART goals is the goal must be specific. The goal must be specific with respect to your abilities and the circumstances of your life. For example, and I like to use this example because I think it is relevant and I think that it's indisputable in regards to its relevancy, and that pertains to the concept of losing weight. A lot of people, their whole goal, every New Year's Eve or every resolution, whether they make it or not or whether they keep it, a lot of people have resorted to wanting to lose weight. This is a specific goal, wanting to lose weight. Is it specific to your life? Only you can decide. The second aspect of goal setting with respect to SMART goals is that the goal must be measurable. What I mean by measurable is that there must be some way of it becoming specific in terms of how you're going about doing it. So for example, just losing weight, it cannot be measured. For instance, let's say you want to lose 5 pounds in 2 weeks. That's a measurable goal. Whether or not that's realistic to you is yet to be determined based on your life circumstances. So when you have goals that are measurable, you also prevent procrastination, rationalization, making excuses and justifications. As I'm sure a lot of people who have tried to lose weight can adhere to this notion that making excuses, justifying their actions or inactions, and procrastinating is quite common. So when you have a goal that's measurable and specific, it prevents that to some respect. The third element is that the goal must be attainable. So your goal of wanting to lose 5 pounds in 2 weeks, is that attainable? Possibly, if you watch what you eat, if you exercise, if you're cognizant of what you're doing, perhaps it is. It can be attainable. However, if you suggest that you want to lose 20 pounds in 1 week, that might be an unrealistic goal, depending on where you are in your life. When you set up an unrealistic goal, you're essentially setting yourself up for failure. And then when you fail, you become more depressed. When you become more depressed, you become more resigned, more apathetic, and eventually you remain stagnant. The third element is the relevancy of that goal. How relevant is this specific goal to your life in the moment? So, I don't think anyone would dispute the fact that losing weight is relevant. It is helpful to your health. It is effective psychologically, mentally. It's a mood booster. I don't know any health condition that is improved by obesity. Cardiovascular disease, diabetes, cancer, depression, anxiety, just to name a few, are not made better by gaining weight. Also, there are many health conditions that are actually caused by obesity. So losing weight is effective in that it is important to your health, and psychologically, it makes you feel better. The better you feel, the more you move forward. Time-based is the last element of goal setting. So if you have the goal of I want to lose 5 pounds in a week and you leave that open-ended, you also have no way of tracking that goal. You have no way of figuring out where you are in your progress. So when you're able to keep a record of it, whether it's a journal, whether it's just an offhand recording of what you've done, how much time you spent on the elliptical, how much time you spent in front of the TV, how much time you spent eating salad versus Big Mac from McDonald's, that way you can keep track of the progress that you've made. So you can identify obstacles potentially that could occur. And that way you also establish accountability. When you have accountability, you are able to move forward. These are the 5 elements of establishing SMART goals. Not easily achievable at times, depending on what your goals are. But what are your choices? Not doing anything about it or trying? If you have any goals that you'd like to discuss, please do so in the comments section. Thanks, guys.